My name is Nia Pia, and here to talk about modified discussion. And for today's discussion, I have been given a scenario based on Victoria and how she is doing during her jog. So for question number 1, the more blood is being supplied to the working skeletal muscles during the activity, and when the body temperature rises, more blood is sent to the skin. This procedure is carried out by a combination of an increased cardiac output and a redirection of blood flow away from the low demand regions like the sympathetic organs. 2. Your heart rate rises as you move more quickly and perform harder. Your muscles receive blood circulation so they may receive the oxygen and nutrition they require to function. For part 1, this increase in heart rate is intended to fulfill the cell's increased need for glucose during jogging, which increases the amount of glucose in the circulation. Part 2, running causes the sympathetic nervous system, a branch of anatomical nervous systems, to become active, which is shown in the picture on the right side of the sympathetic nervous system. 3. Victoria develops hyperthermia while jogging because her vascular circulation occurs as a mechanical function of jogging to meet the need of glucose while jogging. For part 1, jogging increases the involvement of skeletal muscle vessels in the peripheral because her jogging increases the activity of these vessels. For question number 4, when she jogs, the precapillary spinators at the quadricep muscles will be in the open position, allowing the circulation of oxygen and allowing the disposal of extra waste products by increasing blood flow. For number 5, the exercise increases the body temperature and increases the blood flow towards the skin's surface to sweat and cool off. This process can lead to a flushed, red face and red cheeks. So for number 6, the CNS and internal organs communicate with one another through the anatomical nervous system, which regulates the exertion and endurance glands, as well as the smooth muscle, heart, lungs, and heart. So this is how this is happening is that more oxygen is needed to deliver more blood to the body. Her heart rate has increased while she is jogging. For question number 7, Victoria's respiratory rate during exercise is causing the muscles to work harder, which increases the amount of oxygen your body requires and the amount of carbon dioxide it creates. Your breathing needs to become more frequent than 15 times per minute to meet these additional needs while exercising. When jogging, Victoria's sympathetic activation will likely enlarge in the diameter, which will lead to a bronchial issues. The airway's smooth muscle has an impact on the bronchiolation, and the trachea, brachial tree, and terminal bronchioles are all places where it could be found. For question number 9, by strengthening your bones and muscles, lowers your risk of disease, helping you control your weight and improve your ability to carry out daily tasks. Physical activity can help you live a healthier life, especially as we grow into adults who move around more and spend less time sitting down can benefit health-wise overall. So for question number 10, we are going to touch base on the thoracic, brachial, radial, and femoral. Wait a second, where's femoral? Hold on. Femoral, dorsipedius, and posterior tibia, which are the 6 palpates that I have provided to show you guys where they are located. And for part 1, to avoid stimulating the valgus nerve and impairing arterial blood flow to the brain, gently palpate one artery at a time. And that was all for my discussion for today. Thank you so much for listening and for hearing what I had to say based off Victoria's situation during her jog.